5 on your health this morning, treating substance use disorder. There are some effective medications available if you or someone you care about is struggling.
Here to explain is Dr. Jean Lambert, an addiction medicine specialist at Mass General Brigham. Thank you so much for joining us this morning. You're on the front line every day. Have you seen any evidence yet that the worst of the opioid crisis may be over, at least for the Boston area?
Thank you for having me. Before I start, and I will have to cite some statistics, I would like to acknowledge that September is National Recovery Month. As we talk about the ongoing opioid crisis and the challenges we face to cure this disease, I want to send my heartfelt gratitude and appreciation for all of those who are on their own personal recovery journeys, whatever that may be, and whether it includes FDA-approved life-saving medications like buprenorphine or methadone for opioid use disorders, or naltrexone or acamprosate for alcohol use disorders. According to the CDC's National Center for Health Statistics, there was an estimated 107,000 plus drug overdoses in 2023, which from a record high, this represented a decrease of 3% from 2022, the first annual decrease since 2018. Unfortunately, 74,000 of those were opioid-related overdose deaths, which in 92% of those cases included the synthetic opioid fentanyl. However, this was a 2% decrease in deaths compared to 2022. 2022 saw a record number of drug-related overdose deaths, including opioids nationally and in Massachusetts, which claimed over 2,300 lives. In 2023, Massachusetts saw a 10% decrease in opioid-related deaths, the largest single-year decrease since 2009, 2010.
Thank you, Doctor. Doctor, these numbers are just staggering, and we so appreciate you marking the moment of the month also. In your experience, can you share what medications do you typically recommend to treat the opioid use disorder?
I discuss with every patient who meets diagnostic criteria for an opioid use disorder the FDA-approved medications, including buprenorphine or a combination of buprenorphine, naloxone, and methadone. Multiple studies have consistently shown these medications decrease opioid use, opioid-associated complications, opioid-related overdose deaths, as well as all-cause mortality.
Well, people struggle with different issues, of course. Are there any medications available to treat alcohol use disorder?
There are 3 FDA-approved medications for the treatment of moderate to severe alcohol use disorder: disulfiram, acamprosate, and naltrexone. These medications have different mechanisms of actions. Of these, acamprosate and naltrexone have consistently been shown to effectively decrease the amount of drinking, the amount of heavy drinking, as well as decrease the development of alcohol-related liver disease, including cirrhosis, and improve mortality in individuals who have developed alcohol-related liver disease. Like medications for opioid use disorder, medication for alcohol use disorder saves lives.
Thank you, Dr. Jean Lambert, an addiction medicine specialist at Mass General Brigham. Thanks for joining us this morning and letting folks know that there is help and a whole community wrapping their arms around them.
All right, thank you for having me.
Thank you very much.